everything, it definitely gives you a very nice feeling after you study this particular topic. And I really hope you enjoy this. Okay. Next, we have 4 core features of Oracle, wherein we offer you live classes where the educator comes online and they teach you everything online. You can log in to these classes and you can get your doubts clarified live. And you also have recorded sessions. These recorded videos are more than enough to crack any exam and during entrance examination. And we also have notes which are based on the recent CBME curriculum, and of course MCQs, which will help you in your upcoming next examination, right? And you can book a personalized counseling session with us. These sessions are going to be very useful because you'll be given a mentor, and they'll be like a friend to you who will analyze your strengths, weakness, where you are lacking, whether the concept or whether it is the study schedule that you're following is not right. They'll analyze everything, and they'll give you a study schedule, and they'll hold your hand literally, and they make sure that you pass all your exams, right? And we have three different subscription models: basic, standard, and premium. In the basic, you have the pre-recorded classes and live class and quick revision exam modules. And in the standard plan, you have, along with all those features, you have the live doubt clarification session as well. And in the premium plan, it's like all in one kind of a plan where you have everything, right, including the personalized guidance. And you can use my coupon code Dr. Sushma 20 for any additional discounts that you'll have when you buy the plans. And this is the tentative schedule that we have. And on 12th of April, we are going to be done with embryology, right? We're almost done with everything. We have done pharyngeal arches in the previous class. And today we'll do face and palate. And tomorrow, day after and day after's class is going to be really interesting, guys, because GI development is something, I guess, which all of you will enjoy, right? And with that, let's start. Let's start the development of face and palate. Before that, let's just keep calm and recap whatever we have studied until now. We'll just recap and then we'll go to the clinical case scenario. So what was happening? We had a 2-celled zygote, right? And this went on to become a morula, which was a 16-celled stage. 16-celled stage from morula went on to become a blastocyst. Blastocyst had inner cell mass, outer cell mass, and which was initially surrounded by zona pellucida, and then zonal hatching happened and blastocyst got implanted. After implantation, we had 2 cavities formed. One is the amniotic cavity, another is the yolk sac, right? After these 2 cavities were formed, then we had extra embryonic coelom development, right? Extra embryonic coelom, extra embryonic mesoderm, all of these got formed. And then we had the formation of amnion, chorion, right? Yes. After this, what happened? After this development, then we had some cells in the secondary yolk sac which elongated like this, and some cells in the epiblast layer. So what is the cells in the epiblast are called? Cells in the amniotic cavity, they are called as epiblasts. And in the yolk sac, what are they called as? Hypoblast. And the layer is called as, the membrane is called as Huesner's membrane. Remember, cells in the epiblast started running towards the cranial end. After this, it resulted in the formation of primitive streak, right? Then this primitive streak began invagination. If suppose there's the epiblast and here I have the primitive streak, it began invagination and removed the layers of hypoblast, epiblast, and resulted in the formation of definitive endoderm, definitive mesoderm, definitive ectoderm. Then this mesoderm, which is now formed, is called as the intraembryonic mesoderm, started spreading everywhere, right? It started even meeting the extraembryonic mesoderm, but at 2 areas where it was not spread. And those are the, what are those areas? One is the cloacal membrane, another is the buccopharyngeal membrane, where the intraembryonic mesoderm or the definitive mesoderm did not cover, which went on to become the mouth and the anal canal. After this, the process of neurulation began. In the process of neurulation, what exactly happened? We had the formation of a notochord, right? Formation of the notochord, and here is the ectoderm, mesoderm, endoderm. This notochord irritated the overlying ectoderm and converted it into a neuroectoderm, right? Converted it into the neuroectoderm. Further, neuroectoderm formed these invaginations, right? After the formation of these invaginations, it formed the neural tube. Invaginations and all these grooves, it formed a invagination and these grooves, and it came together closer in the midline and it formed the neural tube. And then we have the mesoderm and endodermal structures. After this, what happened, guys? In the mesoderm, the mesoderm differentiated into paraaxial mesoderm, intermediate mesoderm, and lateral mesoderm. Correct? Then we also studied about what were the different structures that were derived from each of these structures, right? From the ectoderm, what did we learn? Two different things we have neuroectoderm and non-neuroectoderm. From the non-neuroectoderm, everything that is in contact with the environment. From the neuroectoderm, you saw what are the structures derived from the neural crest cells, the big list that I had given you, right? Which was the odd man out in that adrenal medulla is an odd man out in there, right? And also it does not form the spinal cord. Two very important points there. Then in the mesoderm, we see the first is the paraaxial mesoderm, which formed the somite, right? Paraaxial mesoderm formed the somites. So somites gave rise to what? Muscles of back and intercostal muscles and dermis of the back and all of these. Then the intermediate mesoderm gave rise to gonads and genitourinary system, right? Then kidney and everything is coming from the intermediate mesoderm. Then the lateral plate mesoderm gave rise to what all? Limbs. And along with endoderm, it forms the lining of the gut. Understood? Till here, what are the different derivatives and everything? Then, after this, we also saw how the mesodermal thickenings form the pharyngeal arches. Okay, we'll see different pharyngeal arches. I've put some slides here just to revise. So this is an entire revision of whatever we had learned in the last 6 classes. Okay, this is how from a two-celled stage, now we have different systems development and we are seeing face and palate today. Okay, yes. Now, a little clinical case scenario, and after that, we'll go to pharyngeal arches discussion. Now, what is a clinical case scenario? Pregnant woman presents to her gynecologist for a routine checkup at 16 weeks. Guys, look at it. It's 16 weeks. All right. Organogenesis, has it completed or not? Yes, it is already completed this is the second trimester. During ultrasound, clinician notes abnormalities in the development of fetus's face and palate. So there is some abnormality in the formation of fetus's face and palate. Further examination reveals that there is a midline facial cleft and cleft palate. Wow. Already the diagnosis is made here, right? The obstetrician discusses the implications of these findings with the parents and provides counseling regarding the potential causes and management options. MCQ. What is the question here? Which of the following structures is primarily affected in this case? Is it mandilla? Is it mandible? Is it maxilla? Nasal septum? Zygomatic bone? I think towards the end of this class, you will be comfortably able to answer this question. Right now, it looks like very difficult, but it's a very easy question, guys. We'll come back to this towards the end of the class. Right. Now, we are today discussing about the development of external human face. It develops between the 4th and the 6th embryonic week. Correct? Development of face is completed by 6th week already. Is it or right? By 6 weeks, the development of face is almost completed. Between 6 and 8 weeks, the palate begins to develop and the development is completed by 12 weeks. Right? Now, there are two important structures involved in the development of nose and face, entire nose as well as the face. Guys, I'm talking about an entire face and the nose. Which are those structures? Pharyngeal arches, neural crest cells. How do they form? Let's see. Pharyngeal arches, there are 6 pharyngeal arches. The first pharyngeal arches gave rise to all of these structures, right? All the mandible, zygomatic bone, and then we had this squamous part of the temporal bone. All of these are coming from the first arch itself, right? So in the developing embryo, there are 6 pharyngeal arches, which we all of us know this, and they arise in the 4th week of development. Now, this is a very, very important table which you have to master. First arch, trigeminal nerve. The skeletal derivatives are malleus, incus, template for mandible. Very important muscles of mastication. Arterial derivatives are none. Second is the facial nerve. So Richter's cartilage, stapes and the upper part of hyoid, which we have already done. Muscles of facial expression, very important. Arterial derivative, it is actually maxillary artery here. All right. Then the third is glossopharyngeal arch, reminder of hyoid bone. That is the greater cornua and the inferior aspect of the hyoid, and it supplies only one pharyngeal constrictor, which is stylopharyngeus. Other pharyngeal constrictors are all supplied by the vagus nerve. That is the fourth arch, derivative of the fourth arch, right? And all the cartilages of the larynx are all supplied by recurrent laryngeal nerve that supplies intrinsic muscles of pharynx. And except for one cartilage of larynx, which is derived from the fourth arch, and which one was that? It's a question for you guys. What is that one cartilage which is derived from the fourth arch? Question you will answer to me in the next class. All right, so this is a basic thing that we had done in the previous class. What are the different derivatives of the pharyngeal arch, which is very, very important. You cannot go to the exam without knowing this. If you go and attend your practical exams without knowing this, you're bound to fail. This table is very, very, very important table. Okay, it's very important. Next, this is just a diagram showing different parts of the pharyngeal arch. As you can see, there is an ectodermal covering, then mesodermal core, and the endoderm, and you can see the clefts and pouches, and you can also see the artery, vein, and nerve. Right? Next, artery, cartilage, and nerve. Next, what are neural crest cells? We have already done about this neural crest cells as well. Correct? In yesterday's class also I had mentioned about them. These are a specialized cell lineage. This is in fact called as fourth layer, right? You have 3 important layers, which epiderm, mesoderm, and endoderm. Ectoderm, mesoderm, and endoderm, which give rise to many structures. This is in fact the fourth layer that gives rise to so many different structures, which I had shown. And these are a specialized cell lineage which originate from the neuroectoderm. Very, very important. By definition, they should actually give rise to structure which are ectodermal in origin. But then what happens? They actually undergo a change, and they derive and they give rise to structure which are mesenchymal in origin. So this is a very important concept, guys. Very important concept, which I've already explained in previous class. You can't afford to get it wrong. Next, as a neural tube forms, cells from the lateral border of the neuroectoderm are displaced into mesoderm. This is what I was talking about. And then they migrate to pharyngeal arches and contribute to their derivatives. So from the neural plate, I told you neural groove is formed, and finally neural folds come together, and the joining takes place from cranial to caudal, and that results in the formation of the neural tube. Any defect in the cranial aspect give rise to anencephaly. Caudal aspect gives rise to all of this: meningocele, meningomyelocele, spina bifida, and all of these conditions, right? Next, week 3 of embryonic development, we are actually now going into the oropharyngeal developmental phase. In the week 3, the oropharyngeal membrane appears, which is the future phase. Okay, it's comprised of ectoderm and endoderm. In the week 4, membranes begin to break, and the future oral cavity and the beginning of GIT. This timeline is also important. When it happens is something that you have to know. Facial prominences are 5 swellings that appear in the 4th week. How many swellings? 5. Is it difficult to? 1, 2, 3, 4, 5. Correct? 5 swellings that you can see it on your face itself, isn't it? They're all derived from the first and the second pharyngeal arch. No points in guessing here, right? Now you can see in this diagram, you can only see the oropharyngeal membrane which is formed here, and you can see it's not covered by the mesoderm, which is very, very important. Correct? You can see here the primitive streak, and this is the primitive knot, and the mesoderm which is getting spread everywhere, but it is not It is not covering the oropharyngeal membrane. You can see here the spreading of intraembryonic mesoderm, which is taking place everywhere except you can see cloacal membrane and oropharyngeal membrane, which is very important. Now, what are these prominences? One is the frontonasal. Correct, no? Nasal prominence, we do have prominent, no? Some people have bigger noses. So that does not mean that this prominence is bigger. It's just their genetics, right? Now, the frontonasal prominence is formed by the proliferation of mesenchymal neural crest cells. Neural crests are, even though they are ectodermal in origin, but the structures they give rise to are mesenchymal in nature, right? Next, mandibular and maxillary prominences, which are the parts of the first arch. So there you go. We have neural crest cells and pharyngeal arches forming the face. Correct? Yes. What is the stomatodeum? It lies between the maxillary prominences. Again, guys, just look at your face and write the development, right? We have the frontonasal prominences, then the between maxillary prominences, what do you have? Mouth. And then what are the two important parent structures that you have to know is the neural crest cell and the first pharyngeal arch. These parent structures you have to know. Other things you can write by yourself. You can see the frontonasal prominences and the maxillary process, and this is the future oral cavity, and this is the mandibular process. Further, okay, let's just take a quick question. Which of the following embryonic contributes to the development of face and palate? Pharyngeal arches, mesoderm, neural crest cells, all of the above. Answer is all of the above. All of the above. Okay? Yeah. Next. During which embryonic week does the primary palate develop from? We haven't still gotten to palate. We're only talking about the face. We'll come back to this question, right? Next, nasal development. Appearance of raised bumps called as nasal placodes are formed on the both sides of the frontonasal prominence. Go back to this diagram, guys. Look at this. This is the frontonasal prominence. On top of that, can you see these two structures developed? Can you see these two structures? This is the nasal placode, which has medial nasal process and lateral nasal process and the nasal pit. Nasal pit. You have the frontal prominence. On top of that, you have this nasal pit, nasal protuberance, right? That's called as nasal placode. Next, maxillary prominences expand medially, and the nasal prominences are pushed closer to the midline. So you have the frontal and you have the maxillary, and here you have the nasal. Maxillary, they expand further. That's why you have the nose, it gets pushed to the midline. If you look at the previous diagram, if this was the frontal prominence, the nasal prominences were looking as if they are the eyes, isn't it? They were looking like as though they are going to form the future eyes, but it does not happen. Why? Because the maxillary prominences which are present on either side, they push the nasal placodes into the midline, and that is the reason why we have nose in the middle and the maxillary processes on the either side. Correct? Understanding this, understanding why the maxillary process actually it pushes the nose. That is the why do you have nose in the midline? Are you understanding this, guys? Yes. Okay. Next, this is the 5-week embryo showing the appearance of olfactory placodes and development of the medial and forming a downward facing horseshoe. So you can see here the medial and the lateral processes and also the nasal pit. And this is the nasal placode. And what do you think these thickenings are? What do you think these are? These are the somites. Remembering anything about somites now? The lateral plate mesoderm, the paraaxial mesoderm arranges itself. If this is the midline, guys, can you see on either side you have the somites able to correlate there, right? Yes. Now look at it. This is how the development takes place. You can see how the nasal pits are present on either side, and then the maxillary starts to push it. And then finally, the nose is come to the midline, joined together to form the nose that we have. Okay. Then the 5-week embryo shows further growth of the medial and the lateral nasal processes and the nasal fat. And by 6th week, it shows closure of the bucco-nasal groove. It shows the closure of the bucco-nasal groove. You can see here, bucco-nasal groove is fused in this or closed in this, completing the floor of the nasal cavity. All right. And this is the 7th week embryo. This is in the 5th week, where you can see it further grows, the medial and the lateral processes, and it forms the nasal sac. And you can see here the bucco-nasal groove is closed. Bucco-nasal groove. That's why there is no communication between the mouth and the nose, right? Why there is no? Because this bucco-nasal groove is closed, right? This is a 7th week embryo, as you can clearly see. And then there's the 10th week embryo, shows the progressive medial movement of the nasal sacs. And you can also see how the maxilla is also kind of developed. The maxillary, you can see it was just this much. And now it started pushing it. And finally, they've come to the midline. Okay, let's look at, we are talking about so many processes and everything, just bringing everything together. The frontonasal process. Frontonasal, derivatives are obviously frontal, so the forehead, bridge of the nose, medial and the lateral nasal prominences. Then we have the medial nasal. Medial meaning midline. So obviously philtrum. Philtrum is this structure, right? Primary palate, upper 4 incisors and the associated jaw. Lateral nasal is the lateral aspect of the nose. Obviously ala of the nose and sides of the nose. Then maxillary process, which is coming from the first arch, gives rise to all of these structures. Cheek, lateral part of the upper lip, secondary palate, and lateral upper jaw. Whereas the mandibular process, which is again coming from the first arch, gives rise to lower lip and jaw. Okay? This is the summary of whatever the structures that we have studied up until now. Then let's go into the development of palate. Development of palate. Okay. Initially, nasal cavity is continuous with the oral cavity. But what happened? What happened was the bucco-nasal membrane got fused. Is it or is it not? You can see here, the bucco-nasal groove got fused. That is why the nasal cavity is not in continuous with the oral cavity. Right. Next, the fusion of the medial nasal prominences with contralateral side creates intermaxillary segment, which forms the primary palate, philtrum, and upper 4 incisors. Whereas the secondary palate is coming from the maxillary process. Okay, maxillary process. So what happens is, you basically have medial, we basically have medial nasal processes like this, right? And we have maxillary processes which come like this. Medial nasal process join together and form the philtrum and everything. Lateral nasal process, they come and they join the sides of the lip. Medial nasal process forms the philtrum and midline of the lip. And the mandibular process on both sides form the lower lip. 6 processes are involved in the development of lips and palate. Okay, it is the same, right? I mean, you have 2 medial nasal processes and a maxillary process coming in like this, and the mandibular process. So all of these join together and they form the philtrum of the lip and upper and the lower lips. Okay, yes. Next, the maxillary prominences expand medially to give rise to palatal shelves, right? And the mandible prominences, they also expand, but the palatal shelves then fuse with each other in a horizontal plane and nasal septum in a vertical plane, and that forms the secondary palate. So the secondary palate is actually formed by the maxillary process. Okay, you can see how the intermaxillary segment, which is formed by the medial nasal prominence, the palatal part, which is formed by the, which is the intermaxillary segment, again is forming the primary palate. Okay, whereas the palatal shelves and the palatal part of the maxillary prominence is what is forming the secondary palate. Okay, and this is how you can see how the nasal how the nasal placodes are. This is the medial and the lateral nasal processes, and this is the oral cavity. Maxillary process is pushing it as it is expanding, and the 2 nose are formed, and the philtrum of the lip is actually formed by the median nasal processes. And you can see this is the mandibular process. Clearly you can see how the this aspect is the secondary palate, which is formed by this maxillary process, and the primary palate. All of these structures, they are basically formed by the median nasal process. Understood? Simple, guys. There is nothing difficult over here, or there is nothing complicated over here for us to know. All right. So let's understand how cleft lip and the cleft palate is actually formed. Very simple, very easy to understand. See, I told you that we have 6 important processes that are forming different structures, right? Which are those? Median nasal processes coming from the nose, maxillary process, and mandibular process. This forms the philtrum of the lip. And when the maxillary process joins in the midline, joins in the midline, it forms the upper lip. And this is the lower lip. So if I have to write it, so my diagram writing skill is really bad, guys. Suppose if this is how the lips look like, right? I hope they do look like lips, not like spinal cord. All right. So it is a, let's say, nose. Very sorry, guys. This looking like pituitary. And medial nasal processes, they come and they form the philtrum like this. And the maxillary process goes and joins them like this, and it forms the upper lip and all of these structures here. Then the mandibular processes come over here and they join in the midline and it forms the lower lip. I'm sorry. This is how lips look like. Okay, please bear with this kind of very messy diagram over here, right? When this fusion of these processes does not take place properly, you have the corresponding cleft. All right, first is the cleft lip. When the median nasal process and the maxillary prominence fail to fuse, right? See how when this and this don't join, if suppose here from here the medial nasal is coming and from here you have the maxillary going, if they do not fuse, what happens? There will be a cleft here. Is it or is it not? Same thing happens with the cleft palate also. When the palatal shelves fail to fuse in the midline or in combination with cleft lip, that causes both cleft lip as well as cleft palate. Problem is mainly cosmetic when it comes to cleft lip. Psychosocial and sometimes unable to feed, and recurrent infections also happen because of cleft palate. Okay, look at this, guys. Look at these diagrams over here. You can see this kid has a midline cleft. Okay, midline cleft, and here you can see laterally there is a cleft which is present, and here you can see it is not the palate is not fused in the midline. It's not fused in the midline. Okay, you can clearly see. You can clearly see. There is a cleft in the, where is it? There's a cleft in the, in this though, it is the palate where you have this aspect where the fusion hasn't taken place. You can clearly see how a cleft is formed here, because the two sides mandibular processes is not coming and they're fusing to the, what is it fusing to? Median nasal process, right? So that is how the cleft lip and the cleft palate actually takes place. Here you can see a very big defect. Okay, how the fusion hasn't taken place. Understanding this, guys, you can see here how the two median processes, they haven't fused, and that's why there is a defect in the philtrum. There's a defect in the philtrum. Okay, don't worry too much about it. It's a very probably I think a PG topic, or even cleft lip and palate is important for your exam, but you should know how it is formed. Two processes, median nasal process and maxillary processes, are coming here, and mandibular process come and join in the midline. If this fusion does not take place, there will be a cleft lip like this. This fusion does not take place, there will be a cleft lip like this. And if the median is not taking place, there will be a cleft like this. And when lower lip cleft is very rare. I mean, you don't generally see lower lip cleft palate, cleft lip, but these are quite common. You come across these cases quite often, right? Yes, you can see how the fusion hasn't taken place. There is a cleft formed over here. Here you can see in the midline the fusion hasn't taken place. That is why you see a cleft over there, right? The anterior palatal defect is caused by the failure of medial nasal process to fuse with the maxillary prominences on one or both sides, right? It can result in cleft lip, unilateral, bilateral, midline, or cleft palate between primary and secondary palates. Okay, you can see how it is not fusing in the midline. Understanding, guys? Understanding? Very easy, very easy. The development of face is actually quite simple. All you have to know is there is a frontonasal prominence, which is important for us. On that, you have the development of the nasal placode. Nasal placode has two structures, medial as well as lateral. This medial nasal process, it comes and fuses in the midline, and it forms the philtrum of lip, septum, and everything. And then the lateral aspect forms the aloe of the nose and all the lateral aspects. Then because the maxillary process is pushing these two nasal placodes together, we have the nose in the midline, right? Then we saw how the cleft and the development of the lip takes place. The upper lip is formed by the fusion of the maxillary processes, and then in the middle we have the medial nasal process. Just a second, guys, let me put it for charging. In the middle, you have the medial nasal process, which is joined, and that forms the philtrum of the lip, and the lower lip is formed by the mandibular process. As simple as it gets. Very easy and very simple to understand, guys. But you have to, to be able to understand what I have taught here, you should have a clear-cut understanding of how pharyngeal arches structures are coming and what neural crest cells are, and then how together they combine to form the face. Okay? Yes. The fusion of which structures forms the secondary palate. Maxillary process. Easy, simple. I've explained this so many times. Which of the following structures gives rise to philtrum of the upper lip? Again, I've told you so many times, it's the medial nasal process. Philtrum of the upper lip, medial nasal. The upper lip proper, this for part of the upper lip, maxillary process. And then this part of the lower lip, mandibular processes. That's it, guys. That's all you have to know. That's all you have to know when it comes to development of the lip and palate. That's all you have to know when any question is asked on cleft lip. Just write about this, how the fusion takes place. If the fusion doesn't take place, there is a cleft that is formed. Understood this, guys? Understood how the face development has taken. From the first arch, you have all of these structures which are developed: mandula, mandible, maxilla, zygoma, zygomatic bone, and the squamous part of the temporal bone. All of these structures are formed by this much structures are formed by the what? First arch. Then the frontal, the forehead and the frontal area is actually formed by the frontal prominences. Then, of course, you have the nasal placode, which is formed, which is pushed by maxilla to form the nose. Then for the lips, you have these processes. What are those processes? These we have already done. And the mandible, of course, two mandible, the pharyngeal arches come and join together. One entire mandible is formed like this. This is how the development of the face is complete. This is how the development of face looks like, takes place, and this is how it is complete. Understood? Understood different parts of the face that are formed from different structures? Enjoying embryology? I hope you really are, right? Thank you so much, guys. Thank you so very much. And you can always follow us across these handles and social media handles, and reach out to us in case you have any doubt. And tomorrow we'll be starting with the CVS embryology, which is very, very interesting. And yes, that's it from my side today. And I'll see you in the next class. Thank you so much, guys. Thank you. I wish you guys all the very best. And I'll see you tomorrow. Thank you. Bye-bye. Good night.